And the UK reported 0 daily deaths for the first time since the start of the pandemic. The country is aiming to end social distancing restrictions in a matter of weeks, but there are some new concerns over a variant that first emerged in India. James Longman joins me live from London with more. James, it sounds like things are going pretty well there right now.
Yeah, Diana, it does feel like that. I mean, this headline says it all. The newspapers this morning in Britain, 0 COVID deaths for the first time since the pandemic began. It does feel like a really good day in Britain. And if you combine that with more than 75% of UK adults now have had 1 dose of the vaccine, something around 40% have had both doses. That's close to where you are in the United States. Things are looking really good for all restrictions to be over by June 21st, because Britain has got a lot of them still in place. There can only be, for example, 30 people allowed at a wedding. They've still shut theatres, nightclubs, stadiums have maximum capacity. But just a few hours ago, the Prime Minister here, Boris Johnson, did say there was nothing in the data to suggest that June 21st day can't be met. I know you guys are working towards the July 4th Independence Day, when restrictions will be done. Well, June 21st is ours, and we're all keeping our fingers crossed.
And James, what do we know at this point about this new variant out of India?
Well, there are a number of parts of the UK that are in a kind of heightened level of restrictions because of this variant. People seem to have travelled here and spread it in their local community. It does seem more transmissible, and there are higher levels of hospitalizations in those areas. But crucially, it doesn't seem like it's any more deadly necessarily, and a large number of those in the hospital have not been vaccinated, up to 75%, I read, in one town. So that suggests the vaccines are really working well. It is the fly in the ointment, possibly, for stopping the June 21st, but it doesn't seem that the Indian variant is going to derail Britain, we hope.
And James, unfortunately, it's a very different picture in Tokyo. The Olympics there are set to go on despite a state of emergency there. Athletes are now being required to sign a waiver, essentially saying that they're competing at their own risk. So what's the latest on all of that?
Yeah, these waivers are actually quite normal for the Olympics. Athletes often have to sign them, but this one is a little bit different. It reads, I agree that I participate in the games at my own risk, including serious bodily injury, so far so good, but here's the kicker, or even death raised by the transmission of COVID-19. It sounds pretty drastic. Organizers say it's just kind of an insurance policy. You'd understand that athletes would need to do that. I mean, look, yes, Tokyo is in a state of emergency. They have seen heightened cases there. A lot of people have been in opposition to the Olympics happening at all because they're so worried. But let's put this in context. It's something like 130 million people in Japan. They've had, in total, since the beginning of the pandemic, around 13,000 deaths. Every death is one too many, but the tolerance in Japan for any kind of outbreak is very, very low. And they have a lot of public opposition to the Olympics taking place, but the government is adamant it has to go ahead. $17 billion. That's what it would cost them if they were to cancel. So it looks like the games are going to happen, but that's what we said last year, and look what happened. We'll have to wait and see. Dan?
All right. James Longman from London. Always great to have you, James. Thank you. Now let's go to ABC News medical contributor Dr. John Brownstein for a little bit more on this. Dr. Brownstein, thanks for being here. You heard James there. The opening ceremony for the Olympics is set for July, but they're still in a state of emergency in Tokyo. So do you think that there's a way to hold the Olympics there safely?
Yeah, it's a good question. Of course, we just heard about these death waivers. Liability waivers are standard practice, but the competitors have reason to be concerned, right? There is that state of emergency. We have low vaccination rates in Japan, just under 10%. But at the same time, the games can be done safely, but it requires the appropriate safety measures and procedures. And we've learned a lot about COVID in this past year. We know how to keep mass gatherings safe. We know how to control spread. And of course, now we even have the vaccines. Tokyo has released this Olympic playbook, which is sort of measures around masking, physical distancing, testing. So all of these combined layered approaches, which we've seen throughout the pandemic, if you can implement them, you can have a safe playing of games. Now, we should be careful here because what's happened with this playbook is they've assigned sort of the same risk to all events. As we know, different events at the Olympics will have different levels of risk. If they're indoors with not great ventilation, mentioned that will be higher risk. We should actually look to the NBA, which has done an incredible job around testing and contact tracing and wearables. Some of those sort of best practices could be applied to the Olympics. So it's not just always about the procedures, but it's also about having the athletes, coaches, volunteers all adhering to these protocols. So what I think is, canceling the games is not, is one way to manage risk, but I think they can be done safely. But as long as everybody is on board with these very complicated protocols to keep all those athletes safe.
And on these waivers, just because they're getting so much attention, athletes always have to sign some kind of a waiver, essentially saying that they could get hurt playing their sport and they're not going to blame the organization that's setting up the games. But to add this extra piece to it now, where they're essentially saying, if I die from COVID, it's not your fault. If you're an athlete, are you worried about that, or does that feel like par for the course?
Well, I think generally waivers are, standard, and you sign them, but you have to be sort of think about the context. Are you being offered a vaccine? Are the sort of the setting that these games are being played at safe, right? Are we doing everything we can to limit transmission and protect the safety of players? If you have that, then I think the waiver makes sense. But if you're just putting all the responsibility on athletes with not really thinking about the underlying risk that, you're bringing to the games, I think that's kind of problematic. And I think that's where the athlete groups have really argued, is think about sort of the broad ways in which we can correct for risk and not just put all that responsibility on the players themselves. And
then the UK is recording 0 COVID deaths for the first time. Sounds like great news. Meanwhile, here we've got Moderna, now the second COVID-19 vaccine to file for full FDA approval. How much of a difference does that FDA approval make? And in general, when you look at the US, the UK, how we're doing right now, how do you feel?
Obviously, I feel great. I mean, we saw the data from the UK, which, 0 COVID deaths, which is incredible. I'll just add a little, I don't want to raid on the parade, but, the caveat is there was a holiday in the UK, so there's reporting delays, as we've known, weird data, that comes in, because there's just not this people counting the data. And also we have this rise in cases because of the variant out of India. And we know that deaths that we see now are a result of cases from a month earlier. So there's a little bit of, small concern, but overall, yes, the vaccines are working. And anything that we're seeing here is because of the widespread use of these vaccines and the need to get people to actually get vaccinated. And I think this Moderna filing for approval is phenomenal, because it's going to allow for Moderna to, first of all, market to consumers. But I think it also will raise confidence in the vaccine. We're at a place where we're hitting a bit of a wall with people really not necessarily getting the vaccine, and any incentive can help. Obviously, free lifts or lotteries, maybe beer, I guess. But I think this idea that, there's still a confidence issue. And then if you have full approval of the vaccine, it really sort of eliminates this concern that people have that it's an experimental vaccine. And so, I think that's phenomenal. And I think it does open the door for potentially vaccine mandates, in schools, military settings, government agencies. So overall, I mean, the data doesn't change. We've seen the data. We know that these vaccines are effective and they work, and that there's no real adverse events. But I think a fully approved vaccine means that just a lot more people may be willing to take it. And for that, we'll continue to see this amazing sort of end to this pandemic that we're all sort of longing for.
All right, Dr. Brownstein, great to have you. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.